to you.
Thank you, Mr. Chair, and thank you for being here this morning. I am going to follow up a bit on some of the questions earlier around communications to the public. I'm wondering if you can speak to whether you feel that you have an unfettered ability to talk directly to New Brunswickers without any consequences or reprisal from government.
I'm sorry, could you repeat that question? My apologies.
I can. I'm wondering whether you feel that you have the unfettered ability to speak directly to New Brunswickers without any consequences or reprisal from government.
Absolutely. Again, as a civil servant, my job is to give advice to the government, and so all of the communication that would happen would be advice from public health to the public, and making sure that everything was aligned, again, with our partners, with our stakeholders, with other government departments. And so I don't feel that there's any public health messaging that I'm not able to share, whether it's in writing, whether it's in an interview, whether it's in a scrum, et cetera.
Okay. And so I'm wondering if you can speak a bit more on the topic of, it does appear that you've stopped speaking to the public for a while. And I know if we look at our neighbors in Nova Scotia, Dr. Strang has spoken to the public on COVID specifically several times in the last year, even as recently as October 3rd. And I mean, there may be other reasons to speak to the public, not just on COVID, but it does appear that in your role as Chief Medical Officer of Health, you haven't spoken to the public in a while, I guess, until today. So could you speak to the reason for that when we do see Dr. Strang, for example, and when you know, COVID is still with us? I think we should acknowledge that there is long COVID and that it is different from other respiratory viruses from what I understand, and that there may be other issues to speak to the public about.
So Dr. Legere has done a press conference on that topic. So I know Dr. Strang's last press conference was around October 3rd. I don't know the date of the one that Dr. Legere did, but public health is available for giving messaging and press conferences and interviews as per our triaging system.
Okay. And is there a reason that you wouldn't have been the one speaking to the public for quite a length of time instead of others?
I think, again, it doesn't matter who from our team speaks, it's as long as those messages get out. So I'm very happy. I trust Dr. Legere, and I think he's a great communicator. So I wouldn't have any problem with any of my team members speaking to the public on whatever issues we deem important.
And I'm certainly not calling into question Dr. Legere's capabilities. I'm just comparing to our neighbors and where their Chief Medical Officer of Health has been speaking to the public. I'm wondering if you can speak to a specific example, or I'm looking at issues around communication. Well, I guess I'll first ask, did you ever feel that the government made decisions that contradicted the evidence that you provided them?
No.
No.
No. Again, Cabinet makes the decisions, and they are made with all of the input of the Cabinet members. So I would give advice, and that advice would be couched with pros and cons, options, and negative impacts, unintended consequences, and Cabinet was able to have very, very fulsome discussions, and Cabinet could make the decision.
Okay. And so maybe you can clarify the difference, or is there a difference between offering advice or giving specific recommendations for what government should do? Was that ever what you presented? Not just advice, but like, I recommend you do this?
Coming back to the early slides, my role is to advise. My role is to give recommendations, but in the context of, again, the conversations that are had at Cabinet, the conversations that were had with the other government partners, and one of the slide that has all the different partners in it, it's like a Venn diagram.
The rainbow-colored one.
Yeah.
Yes, I know which one you're
Yes.
talking about.
Yes. So I was very comfortable with being able to be at every single one of those COVID cabinet meetings and cabinet meetings with my recommendations and options, and making sure that everybody was able to have conversations about the pros and cons and the operationalization of whatever recommendations were on the table, as well as communications challenges and barriers. So all the pros and cons for every option and every recommendation was always on the table, was always being discussed.
Okay. So I was going to ask if government, did government ever not follow your recommendations?
So again, I'm very comfortable with how the process of cabinet and COVID cabinet had unfolded, and prior to the pandemic and moving forward, I'm very comfortable with the ability to give my best advice and my best recommendations, again, with an all-of-government approach, with an all-of-society approach, because public health does not work in a vacuum. We do have to look at the social determinants of health. We do have to look at the effect on the economy, on people's mental health, on people's education, on people's social connections, et cetera.
Okay. There has been a perception by some and concerns about the independence of the Office of the Chief Medical Officer of Health and around decision-making. And I know that in that rainbow-colored picture that was shared, how there's political, opinions, or what was it? It's not up there, so I want to say the right. Political preferences is in there as one of the things. So I'm just thinking of an example where it was hard to understand how the decision-making went, and that is when Dr. Muick spoke publicly August 26, 2021, and recommended that all New Brunswickers wear masks indoors. And a few days later, on the radio, the Premier indicated, well, if people are vaccinated, we don't want to sort of punish people. And then on September 1st, I believe you indicated, well, the choice is yours. And there seems to be, I don't know if disagreement is the right word, but inconsistent messaging, where Dr. Muick seemed to be saying that everyone should be masking indoors. Then the Premier went against that, and then in the end, by a month later, we were back into masking and another wave. Can you speak to what that decision-making would have looked like, and how that messaging, like, sort of how did that happen, and I don't want to ask, was Dr. Muick wrong, but how did that situation happen?
I was on vacation at the time, and so Dr. Muick was acting on my behalf, and I can't speak for exactly how that unfolded, but I can say that the experience of our communications team in terms of making sure that the messages are presented in a way that the public can understand. It can be confusing if the words are nuanced in a way that that doesn't quite resonate with the public. I can't speak directly to what took place at that time, because I was actually on vacation during that time. I can only say that there are some times when you might say something is something that you could recommend in terms of, this is a good suggestion, and that's what I was saying when I was interviewed after that it's a good suggestion in terms of, yes, people can make that choice. But there's a difference between what has to be mandated in the mandatory order or in policy versus what advice is to the public. So I think there's some nuances there that I can't speak to, in the sense that I wasn't there, I was on vacation. So all I can say is all of the public health decision-making went through a certain cycle, as I've described, but I wasn't on the ground at that particular time because I was on vacation.
Okay. Well, and I guess in terms of clarity, when well, and I'm not the only one, I'm sure, that listened to every press conference every day at 2:30 and listened to all the radio interviews. And so, like, I felt that there was very much clarity in terms of what Dr. Muick said. I found saying the choice is yours and some of the messaging to be less clear. And I, in my role, have fielded lots of questions, and I know in your role you do as well. But I guess the question that comes up is, was there political preferences in terms of the messaging and the decision-making at that time? The cases were going up, and we ended up going into like having to bring in restrictions a few weeks later. So were political preferences part of that decision-making once you were back from vacation, because you were back by September 1st?
Again, I can't speak to the decision-making cycle at the time that I was off. I can only speak to what happened when I returned. And in the decision-making cycle, in terms of whatever was going to be happening in Cabinet, we would have continued to feed that information into those meetings. So that's all I can say right now, is that when I was on vacation, I can't speak to what happened while I was gone. I can only speak to what happened when I returned, and again, what Cabinet would have been deciding in terms of how that information flowed through. There was no difference in terms of the entire pandemic in terms of how that, when I was there. I can't speak to what happened when I was on vacation.
Okay. In terms of decision-making and political preferences, I know there were times where officials such as the Premier would have spoken publicly and talked about, well, this province is doing this. For example, Alberta's doing that, so that's sort of why one of the reasons that we're going to choose this path for decision-making. Would that have been one of the factors in terms of the decision-making that you were aware of, looking at other jurisdictions?
Through the entire pandemic, we would have always taken into account what was happening in other jurisdictions, as I mentioned earlier, around the prompt teams and what was happening in British Columbia and Quebec around long-term care facilities. So it was always important to understand the context across the country, because we knew that if something was happening in another province that wasn't happening here, or vice versa, that we would have to be able to try to explain that to the province, to the population, which wasn't always simple or easy. So we did our best, but it was confusing, and sometimes, again, we were trying to make it less confusing. Obviously, that was our job, to try to help people understand what it was that people needed to do to stay as safe as possible and protect our healthcare system.
Earlier, you spoke about your role and about, mandatory orders, all of that. Can you speak to whether you were consulted about potential amendments to the Public Health Act in order to use that to replace the Emergency Measures Act?
I remember having conversations about the Emergency Measures Act. I remember having conversations with my colleagues across the country about what they were doing in their provinces. I don't remember all the details of those conversations. I remember having conversations, but I remember the ultimate decision was that it was going to be a mandatory order. There were reasons for that at the time that escape me now, but I was part of those discussions. Okay.
And are you referencing, like, sort of March 2020? That discussion? Is that what you're referencing?
Well, I'm not sure if it came up more than once, but definitely whatever conversations took place during the pandemic, I would have participated in them.
Okay. I'm wondering if you can recall when those conversations would have happened. Did they only happen at the beginning? Did they happen regularly? How? Because I think that this is something that well, it even ended up coming to the legislature in some form later on, but I'm wondering if you can tell us anything you can recall about those consultations.
I do remember the original discussions. If we had more discussions after that, I would have participated. I just don't recall them, but I do remember participating in those discussions, and yeah.
Who were those discussions with?
I'm assuming that, again, this is a long time ago, so you're asking me to go back and think, but I do know that they would have happened in Cabinet with Justice and Public Safety there. But I don't know what other conversations, I don't remember other conversations. I know I was, whoever was having the conversations, I was participating. I just don't recall who and when.
Okay, yeah, I'm just trying to figure out what, yeah, like on this org chart, where the conversations would have happened. So you're saying at cabinet?
They could have happened at the planning meetings. I don't remember where they happened. I just know that I was part of them.
Okay.
Thank you very much
Mr.
for
Chair.
that.
Thank you.